Stamp Out Sleeping Sickness, One Health in Action.
Stamp Out Sleeping Sickness has given us an opportunity to demonstrate to a country that different groups of people can work together for the common good of the people affected by sleeping sickness.
Professor John David Kabasa, the forward-thinking Dean of the Veterinary Faculty in Kampala, motivated 50 of his final year students to go out into the communities to carry out an extremely difficult job in rough terrain dominated by papyrus swamps.
SOS is one of the pillars that we see is being used to transform the university, because we have a clear agenda of taking the university to the community.
A sustainability study was carried out in the area during 2008 and uncovered real challenges. Veterinary services were most often not available, and whilst cattle owners were ready to buy the products, they could not afford to travel the 60 to 70 kilometres into towns to find them. The SOS partners encouraged several of the former veterinary students to establish their own veterinary practices and product outlets, providing them with startup financing and business skills training.
When I opened the drug shop in around 2009, farmers welcomed it, and it was really a rescue to them because of the problems they have with their animals, especially trypanosomiasis.
At first, it was not easy for them to be accepted into the communities, as they were considered as foreigners or not up to the task, and had to first win respect.
I didn't grow up from here. Actually, the first time I came to establish the shop was my first time to come this side. So when I came, they received me well, although most of them were hesitant at first, being a lady and being very small. Some of them were like, she can't do much. They doubted me, like for the first months. The biggest scenario I had was when someone was directed to me, was told, "You want your animal cured?" They described me and he came. So when he came and he met me, he thought he was going to meet someone fatter and maybe a guy. So when he saw me, he started jeering at me and saying, "This person is maybe not, he doesn't understand, is he mad?" So at the end of it all, when we went to the animal, it was recumbent. I gave the first treatment, it got up. Then he started spreading the news, we have a doctor.
I believe that the initiatives for transformation of society comes from a few, and these have to be spread to the whole society so that they adopt those values as core for transformation.
In total, 11 practices were established in the region. They in turn generated more employment through the creation of a network of self-employed spray persons who treat cattle on a pay-per-head basis.
We basically train them to be able to apply the Ikare on cattle and other animals, to be able to protect the cattle and protect the communities against sleeping sickness. A number of them have been able to grow, because I know of 3 who have been able to construct permanent houses for themselves out of the business. So I think this is quite an important initiative that helps communities to be able to sustain their livelihood.
SOS Consortium are on the front line of what is currently a quiet battle against a disease that is sleeping but could flare up at any time if the communities decide to stop treating their cattle or more practices fail.
In Uganda, the population does not seem to know. There has been some complacency. As a result of the numbers of cases coming down and also of the disease coming down, people thought there was no more problem. So with this, we need to expand this to all over the country. And it must be intensive.
We can do this approach together. And what we are saying, when done together as a package, it is very effective. It is because they have been at the center of the problem, and they have also witnessed the dramatic effect of this One Health intervention, which combines effective surveillance routinely in humans and block treatment in cattle and spraying them. How effective it is in reducing cases.
The SOS intervention has proven that committed partners can engage communities to protect themselves in a sustainable way, but the private model alone is fragile.
I believe that SOS is thinking together, working together, and shaping together.
Now, more than ever, is the time for government, communities, and interested global health partners to come together to support such simple ways of delivering real One Health solutions. People, government, science and business at work, together beyond animal health.